The Phlebotomy Textbook, Chapter 8, Routine Venipuncture. Learning outcomes and key terms are found in the PowerPoint file on eLearn. Venipuncture is the most frequently performed procedure that you will perform as a phlebotomist. You must follow the standardized procedures established by your employer to maintain a safe environment for your patients and yourself. You should develop your style of patient interaction and technique that meets the standards or regulations required for phlebotomy. The standard procedure is outlined in Chapter 9. The rules, regulations, and procedure must be followed at all times. According to the Clinical Laboratory Standards Institution, a standardized venipuncture procedure can reduce or eliminate errors that can affect specimen quality and the patient's test results. A requisition form is an order for which tests are being collected. Do not collect a sample for testing without an order. This order is usually electronic, but you can also get paper forms sometimes. An electronic test order will contain all the required information if the system has been set up appropriately. When you receive a manual order, you must ensure it has all the patient's full name, first name, and last name, whatever identification number that is required, the patient's date of birth. For inpatients, the location the patient can be found, the test requested, the time and date the specimen should be collected if a specific time or date is required, and special collection or patient information that is needed, and billing information. The patient's room number should never be used as a means of identifying the patient, as patients do not stay put. For example, a doctor can't ask, collect a complete blood count on the patient in room 12304. This is an example of a manual form. Handwritten forms are not ideal, as bad handwriting or misspelling the test can lead to the wrong test being collected and potentially delaying patient care. Labels are sometimes printed and taken with you, but you usually should not have to manually label a specimen. Many facilities have portable label printers that you can use to scan the patient's ID band and print the label at the bedside. Always correctly match the order to the patient's identification. For inpatients, if the door is closed, knock before entering. When you enter a room, look for signs which may give you information about allergies or restrictions. For example, NPO, which means nothing by mouth and includes no drinks at all. They may also have allergies to latex or iodine. You should introduce yourself and explain your purpose of the visit using non-technical terms such as, "Hi, I'm Jean, and I am here to collect your blood today." A patient must give consent, which may be verbal or nonverbal. They may say, "Okay," and give you their arm. But if they say they don't want you to collect the sample, then you should not do so. You should notify the nursing staff and put a note in the record that the patient refused. Talk to the patient during a procedure and try to get them to speak to you while you are doing this. If a patient is talking to you, then you can notice if they start to pass out. Always have good communication skills. Ask them if everything is okay and tell them thank you and have a nice day, or I hope you feel better. Something like that. The most important procedure that a phlebotomist performs is the patient identification. If you collect blood from the wrong patient and the sample is labeled with someone else's name, it can cause the death of the patient or delay care. The Joint Commission, CLSI, and CAP recommend two identifiers such as first and last name and date of birth. These are the two that we will use in our class. You must ask the patient to state their first and last name and date of birth, not "Are you James Jordan, born November 15th, 2000? You must compare what the patient tells you with the identification band on the patient. If an inpatient does not have an ID band, you must ask the nursing staff to band the patient before you may collect their blood. If you collect the wrong patient, the wrong results can end up on their patient record. A wrong blood type can lead to a fatal transfusion reaction. It's very important. Outpatient identification usually involves the patient presenting with an ID card at the desk. When you bring them back, you will ask them to state their name and date of birth and compare that to the printed labels. If a patient has an outpatient procedure or is just in the bed for the day, they will have a wristband. If a patient walks into a blood collection facility, they will not have a wristband. The patient's wristbands now usually have a barcode which allows you to scan it with a mobile label printer. This can interface with the laboratory information center and be able to make a label for each tube that is required. The label will usually tell you what type of tube to collect. Radio frequency identification is an automated wireless technology that uses radio waves to transmit data for ID. RFID allows additional information to be added later, but a barcode must be reprinted if more information is added. To prepare a patient for venipuncture, first reassure the patient throughout the procedure. Start with a brief explanation of the procedure so they know what is to be expected. It is not your job to give them specific details of the test that you are collecting, but you could tell them the name of a test, but not why that test would be ordered. If fasting is required for a test, then you must verify the patient has been fasting. You should also ask the patient if they're taking blood thinners, as this can mean that more pressure is needed applied for a longer period of time before applying the bandage. You should also ask if they have any allergies that you should be made aware of, or if a patient is allergic to latex, you should assure them that the tourniquet gloves and bandage and other supplies do not contain latex. They may want to see the packaging if they have had severe reactions in the past. The patient should be positioned in a seated or reclined position and never standing. A patient who passes out can be reclined or laid flat, which can prevent them from passing out. If a patient is chewing gum or eating, ask them to remove gum or candy or swallow food they are chewing before you start. A specially designed chair will have an arm that comes down in front of the patient. This supports the arm and can also prevent them from falling out of the chair. It is good to have the arm fully supported and angled downward, such like using a wedge cushion. When adjusting in patients, always remember that you must return the patient to the original position and put arm rails up, especially for patients with a fall risk. The patient is usually laying in bed, and you will need to ask them to make their arm accessible or adjust it into the correct position. The arm should be supported and positioned downward. Remember that patients should not have anything in their mouths when having their blood drawn. Here you can see one patient supporting their arm with the fist of their opposite arm, and the other is using an arm support wedge. Re-examine the laboratory order to ensure you have the supplies you need, and you would select appropriate supplies based on the patient's age and condition. You will need the correct type and number of tubes, the appropriate gauge needle and holder, syringe, or butterfly, the antiseptic, bandage, tourniquet, and a 2x2 gauze. You will need to inspect the supplies to ensure the equipment is intact and the packaging has not been tampered with. Select all of the supplies that you need and place them so you can reach them when performing a phlebotomy. You shouldn't place supplies on the bed or patient. Supplies should be placed on the side of your non-dominant hand, which is used to change tubes. You will be holding the needle holder with your dominant hand. You should place your tubes in the order you will be collecting them. You want to have extra tubes handy in case the tubes have lost their vacuum and you need a new one. Hand hygiene is the most important factor in preventing healthcare associated infections. You should wash your hands with soap and water or use a hand sanitizing gel in front of the patient. Follow the procedure established in your facility. A good procedure is to introduce yourself, ask the patient to give you their first, last name, and date of birth, then tell them that you're going to wash or sanitize your hands and get your gloves after you verify you have the correct patient. The tourniquet is applied 3 to 4 inches above the venipuncture site. It will impede venous flow, allowing accumulation of blood and making the veins easier to find. Arterial flow is not affected. The tourniquet is applied, the vein is located, the tourniquet is removed, the site is cleansed. You prepare your supplies while the alcohol dries. Reapply the tourniquet. Anchor the vein and insert the needle. Do not leave the tourniquet on for more than 1 minute. CLSI recommends that you release the tourniquet for 2 minutes between applications. While training, we normally do this step in 2 steps, while many phlebotomists are able to find a vein, clean the site, and remove the tourniquet in 1 minute. See Procedure 8-1 for further explanation. Position the tourniquet 3 to 4 inches above the venipuncture site. Cross the ends over and tighten. Use your dominant hand to tuck the tourniquet section that is on the bottom over the top. This means the loose end is up and the loop is towards the antecubital area. The image on the left shows the arm ready for venipuncture. The loose end is what you pull to remove the tourniquet. When selecting a vein for venipuncture, we feel for the major veins of the antecubital fossa. The median cubital vein is between the other two and is the best option. The cephalic is the most lateral and the basilic is the most medial. If you remember that B is for basilic and B is for body, then you know which one is nearest the body. The veins can form an H or an M pattern. On some people, the veins on the lower arm may bulge and be good options, but this is not as common. The image on the left shows an H pattern, and then the image on the right, an M pattern. The dorsal side of the hand can be an option if you can't locate a vein on the antecubital fossa. The dorsal side of your hand is the back of your hand, not your palm. Vein location is done both by sight and feel. You should apply a tourniquet and have the patient clench their fists. The ability to feel the vein is much more important than the ability to see a vein. Using the index finger on your non-dominant hand to feel for the vein using a pushing rather than a stroking motion. You will use palpation to determine the size, depth, and direction of the vein to help direct the needle during insertion. Landmarks on the patient's arms can help you to remember where the vein is after you have cleaned it, as you cannot touch the area again before inserting the needle unless you clean it again. For routine venipuncture, you will use 70% isopropyl alcohol and use a back and forth motion to scrub the area. The drying time is from 30 to 60 minutes, and you should not insert the needle when the area is wet, as this can cause a burning sensation and the alcohol could get into and contaminate the sample. You should avoid blowing, fanning, or manually drying the site with anything. While the alcohol is drying, it is killing microbes. When the alcohol is drying, you should gather your supplies. Make sure that they are on the side of your non-dominant hand to avoid reaching over. Attach the multi-sample needle to the holder. You will screw the stopper puncturing end of the double-ended multi-sample needle with the clear cap onto the holder. The needle and holder may come pre-assembled by the manufacturer. Do not remove the sterile covered cap from the other end of the needle. Insert the first tube to be collected into the needle holder up to the designated mark without puncturing it. Visually examine your supplies for any damage or expiration dates. Make sure there are extra tubes within reach. Reapply the tourniquet. Move the safety device out of the way. Remove the colored needle cap. Examine puncture equipment for defects. Position the needle assembly with the bevel up. The BD brand needle has the safety device up, so make sure it is up. You will then anchor the vein with the thumb of your non-dominant hand. Position your 4 fingers around the arm, but make sure they aren't trapped under the arm. If veins are on the surface, they might roll and the needle will not go into them. You should insert the needle at a 15 to 30 degree angle. Don't go too deep or too shallow. To fill the tubes, you must hold the holder and needle steady, making sure that you do not push it in deeper, while using the non-dominant hand to push the tube into the sampling needle. You hold the flange with your index finger while pushing the tube with your thumb. Allow the tube to fill. To prevent any chance of blood refluxing back into the needle, hold the tube at a downward angle and apply slight pressure while the tubes are being filled. Be sure to follow the correct order of draw. Then use your non-dominant hand to pull off the tube with a twisting motion while holding the holder steady with your dominant hand. Invert the tube. Use your peripheral vision to grab the next tube and insert it as you did the first tube. Repeat until done with the tubes. You can brace your hand on the patient's arm to hold it steady during the process. Instruct the patient to release their fist and remove the tourniquet after the last tube has been drawn. If there is a large number of tubes and the tourniquet has been on for a minute, it may be released before the draw is complete. The tube removed last should be removed before the needle. The last tube will be removed before the needle is removed to prevent dripping. The tourniquet should be removed next to avoid bruising. The bruising is known as a hematoma caused by bleeding under the skin. Remove the needle with a swift, smooth motion while being careful not to drag it across the arm. Then the needle is removed and the 2x2 gauze is applied with pressure. Do not apply pressure while the needle is still in the arm. Activate the safety device and dispose of the needle in the sharps container. Ask the patient to hold pressure on the site. Invert the tubes the required number of times for the additives or anticoagulant. The process of needle disposal is completed while also asking the patient to hold pressure or holding pressure yourself. Remove the needle, activate safety device, put in sharps container. Do not bend, cut, or recap the needle. Do not stick the needle into a patient's bed. While the patient is holding pressure on the site, this is the time to label the tubes. Most tubes are labeled with a printed label that is computer generated, but you may have to write on the label also, and you should use a pen with an ink that won't run when it gets wet, such as a ballpoint pen. You must include the full name, date of birth, date and time of collection, and your initials. You can confirm the patient's name again. Notice it's 5 things: patient's name and date of birth, the date and time of collection, and the phlebotomist's initials. Now that the tubes have been inverted and labeled, it is time to check to see if bleeding has stopped. Lift the gauze to check. If there is no bleeding, apply a bandage or fold the gauze and apply a wrap. You should ask the patient which they prefer. You can use paper tape if a person is allergic to Band-Aids, but most people prefer the wrap. Once you have completed, the tubes are labeled and set in the appropriate location. Remove the contaminated material. The wrappers, caps, alcohol, wipes, and gauze can go into the regular trash. Needles and used tubes not needed for testing should go into the sharps container. If something is dripping with blood, it should go into a biohazard trash. This should not happen while performing phlebotomy. After bandaging, labeling tubes, returning bed to original position, bed rails up, remove gloves and sanitize hands, and thank the patient. The specimens must now be delivered to the lab. This can occur at a specific time in containers with couriers, a dumbwaiter, or through a pneumatic tube system. Make sure you complete any required paperwork or logging information in a computer. Some sites may log the number of samples collected for statistical purposes. Make sure you never leave a sample in a patient's room or unlabeled. Getting the label wrong can kill a patient. Thank you. This concludes the presentation.